Demonstration of the hepatitis survey kiosk. Sorry, my computer screen just fell down, a spare one. As you can see, it's in 4 languages. We have it in English, Spanish, Creole, and Portuguese. We're actually wrapping up the Portuguese version so we can incorporate it into the actual technology. This is the language selection screen.
Do you have hepatitis? Enter medical record number.
So if the medical assistant in the clinical facility usually enters this, if they try to move on to the next screen,
information incomplete. Do you want to continue?
If they try to move on to the next screen without entering a medical record number, they're prompted to complete the information, and so they'll do so.
Please read the consent page or press the button with a picture of a speaker to listen to consent for this project, and press the green I agree button to continue.
This is the consent page. We got a waiver of written consent from our IRB, so the consent is done through the computer kiosk. They can either hit the speaker button and the whole consent will be read to them, or they can just kind of either read it, or like most people do, they kind of look through it and they just either don't agree, they go back to the desktop or the initial desktop, or they agree.
Chronic viral hepatitis is an infection of your liver that can cause liver failure, liver cancer, or death. Hepatitis C and B infection are the main causes of chronic viral hepatitis. Treatment is available for both hepatitis C and B. This survey is to help you avoid death from liver cancer or liver failure from chronic viral hepatitis infection. If you have any risk factor, we do not care what risk factor you have, only that you might need to be tested. If any risk factor applies to you, check the Save My Liver Now button at the end of the survey. Press the green Next Page button to continue.
So again, we just really emphasize the importance of Hep B, C testing, and the consequences of chronic viral hepatitis if it goes untreated, or potential consequences. And we really also want to stress that we don't really care what they're doing or what they did or what their risk factor is, only that they have any risk factor.
Enter your age.
And then we just go through some basic demographic information.
Enter your sex. Enter your height in feet and inches.
That's my cell phone making that noise with the speakers. And height.
Enter your weight in pounds.
And we do weight. It also has a BMI calculator. As you can see, as the weight goes up, the BMI goes up, and we're going to use that to assess our risk for fatty liver disease. Well, we'll just put this one right over here, say BMI 40.
Enter your race.
We also want data on ethnicity.
Do you have diabetes?
Diabetes is important because with our BMI calculation and diabetes, we also use that to determine risk for fatty liver disease.
Are you pregnant?
And we like to know that.
How much alcohol do you drink?
And as you know, alcohol and hepatitis are a bad combination. We want to get an idea if people are drinking.
Information incomplete. Do you want to continue?
And if they don't answer that, obviously, as we stated before.
Have you ever tested positive for hepatitis C or B? Region of birth. Enter where you were born by pressing the region on the map.
And the next version is going to have a much more refined interface and a little more detail in terms of countries. This is for region of birth, so obviously Sub-Saharan Africa, Southeast Asia, places like that are going to prompt Hep B testing. So we're going to improve the detail in the South American mapping to get access to those folks in the Amazon basin for Hep B testing as well.
The following questions are to educate you about risk factors for hepatitis C or B infection transmission. No answer is required.
And again, we want to reiterate that we're not asking them to respond with an answer of any sort. We just want to bring them through the educational survey.
Were you born or lived at least 6 months in any of the areas colored red on the map?
In the next version, they'll be able to actually hit these areas, and it'll prompt a response to get them blood tested.
Did you receive a blood transfusion or organ transplant before 1992? Do you have or have ever had abnormal liver blood tests?
So in these, start off with some non-embarrassing questions.
Have you ever used injectable street drugs or have ever shared needles, even if one time or many years ago?
Then,
have you ever had sex with someone who uses or used injectable street drugs?
So bear in mind, the speakers would be used inside an enclosed setting like a small room or a closet. We're actually going to be using disposable headphones when we start with this survey. Obviously, I don't think people are going to feel all that comfortable if these questions are being asked out loud.
Have you ever sold sex for money?
As you can probably guess.
Have you been treated for gonorrhea, syphilis, chlamydia, herpes, or any infection obtained by having sex? Are you a man who has had sex with men or a woman who has had anal sex? Did your mother have hepatitis B or C infection when you were born? Do you use or have ever used kidney dialysis? Have you ever tested positive for HIV or the AIDS virus? Do you live or have ever lived with someone who has hepatitis B? Any of these risk factors can cause chronic viral hepatitis. Untreated chronic viral hepatitis can cause death from cirrhosis, liver failure, or liver cancer. If any risk factor applies to you, press the yellow button, Save My Liver Now, and give printout to your doctor.
So if they have a risk, they just hit the big yellow button, and boom, and they can acknowledge that it was being hit by seeing the red circle, and then they would hit the survey.
Your information
button,
tells us you are also at risk for fatty liver disease.
And if their BMI is greater than 30 with the presence of diabetes, or if their BMI is 35, regardless of history of diabetes, they're going to get prompted to this screen. And then the printout will be generated, which they will give to their physician. And on the printout, there will be a number code that will let the physician know what their risk factor profile for that would require B Hep C testing would be. And as you can see from the printout, wherever it might be, but there you go. So the right upper hand side, it says 111222, that indicates a risk factor. A 222111 would indicate no risk factor. In the future, when we get the better mapping system, it'll obviously, if for South America, you would see Amazon Basin, or you'd see Sub-Saharan Africa, and that obviously should also prompt of testing for Hep B. This printout, we have a newer version which actually also gives them a summary of the CDC guidelines for Hep B, Hep C testing. And that's about it. We'll give you a demonstration of the Spanish and Creole, or actually what I'll do is I'll make a movie so you can see those as well. Okay.